Today we begin the public hearings into Module 3, investigating the impact of the Covid-19 pandemic on the healthcare systems of the 4 nations of the United Kingdom. The hearings will last for 10 weeks in all, divided into 2 sessions. We shall take a 2-week break in mid-October. This will allow counsel to the inquiry and for the core participants to ensure they are as fully prepared as they can be for the second session. We have a huge amount to get through, and the only way we can do that in the time I have allowed is by strict adherence to the timetable. I apologise in advance to those who would like us to spend more time examining particular issues in these hearings. I understand their concerns. But as I've said before, the longer any set of hearings take, the longer the delay in making recommendations, and the longer the delay in investigating other important modules, such as the impact on the care sector and children and young people.
I was taken straight away into intensive care, and they thought I was going to die at that point. I remember lying in bed and the doctor standing by the side of my bed saying, "Will you sign a piece of paper to let us put you to sleep?" So I said, "Yes, will I wake up?" And the doctor said, "Well, we've got a 50-50 chance." And then I said, "If I don't sign," he said, "well, 0. I am a different person, and my body is different from before. You see, I have permanent damage from COVID, so it's like another kind of long COVID. So my eye that I can't really see with, my ear that I can't really hear with, my numb toes. I mean, people in my situation who maybe are in their 20s, 30s or 40s, perhaps this is more bewildering than for me. This may well have a huge knock-on effect health-wise. We just don't know at the moment. You know, a big change has happened, you know, and it can't just be solved by saying there is this virus and this is what happened to people's bodies, the end. It can't be solved that way.
I was a student paramedic at the start of 2020, so I was coming to the end of my training as we were starting to get the whispers of this respiratory condition. I was out with a colleague, and I had a patient and was coughing, and there were visible droplets coming off of her, and she coughed down onto my face. I remember it reaching the top of my nose, and I tested positive 2 days later. That was the first time I got it. And at the time, my wife was 6 months pregnant, and I didn't know if I was going to kill her. I didn't know if I was going to kill my unborn baby. We tried so hard to play the game. We tried so hard to make sure that people were safe.
We started to get people coming through who were having anosmia, where you can't smell. But again, we still hadn't put 2 and 2 together and realised it was COVID. But that was early, mid-January that was happening. We also decided we had to do lots more home visits. Most people, it was better for us to go to them than them to come to us. So we're sort of standing on balconies trying to put on, you know, don and doff our PPE, and before we went into a house which was COVID infected. I can remember going and seeing one of my patients who had rung me in the morning to say he was sick. Now, I'm not going to hospital. I went to see him on my way home into the room where he'd been all day dying. I did get him into hospital that night, but he was dead by the morning.
His eyesight was getting worse and worse and worse, and I says, "Craig, there's something not right here." Craig had a previous brain aneurysm when he was 21. So I phoned 6 different opticians and asked them for him to be seen, and I was told no, there was no appointments. And they said, "Has he got a headache?" I said, "No." They says, "Well, we can't see him." No, that was a receptionist triaging a patient on a phone. He didn't want to go near a hospital. He didn't want to go and bring anything back to me, and he collapsed at work. And he died on the 3rd of September with a brain aneurysm. The hospital consultant, the neurologist, told me, "Caroline, Craig didn't die of COVID. He died as a result of COVID because he couldn't get seen. So because he didn't have a headache, they played lottery with his life and he died." They were just so unprepared.